My name is Max Carwile, and I work at Planned Parenthood of Tennessee. I want to first say thank you all for having me here today. I've never spoken in front of a legislative body, so this is pretty exciting. I wish it was on happier subjects and not ones that I find extremely upsetting. I'm a born and raised East Tennessean, born in Knoxville, raised in Knoxville, or born in Morristown, raised in Knoxville, went to ETSU. And I'm here to talk about what all this looks like here in Tennessee, because we haven't heard a bit of that here today. Like I said, I am a current employee of Planned Parenthood of Tennessee and North Mississippi, and a former employee of Knoxville Center for Reproductive Health, where there is no employee named Caroline. I am opposed to this bill because I do not think our government should be in the business of legislating whether to or how we should grieve. Through my work on an abortion storytelling program called the Tennessee Stories Project, I have heard countless experiences of people sharing what it was like to make the decision to end their pregnancy here in Tennessee. Many factors and emotions go into these decisions, and it is pure government overreach to dictate how our patients find closure or heal if they need to. I am also someone who's had an abortion here. As the very population this bill attempts to affect, I oppose it. Like some of the previous speakers, I have also been on all sides of this debate. Through my work at the Knoxville Center for Reproductive Health, I sterilized medical supplies following in-clinic abortions in the same room that the doctor handled the medical tissue, and I learned a great deal about the care and respect with which medical tissue is handled following an abortion. Health centers comply with all state laws regarding fetal tissue disposal, which is handled by the same professional removal companies, not grinders, used by other healthcare providers for other medical material. Health center staff here in Tennessee also talk with patients on a case-by-case basis to answer all of their questions about how fetal tissue is handled. And these are just a few of the reasons this bill is unnecessary here in Tennessee. Again, I can't speak to what other states are like, only Tennessee. It's incredibly clear that this bill isn't about giving people seeking abortion care options. It's about limiting which options exist for us. There's no medical or rational justification for treating tissue from a procedure performed at an abortion clinic any differently than tissue from procedures performed at hospitals or the embryos that fertility clinics must dispose of. This bill is about nothing other than stigmatizing and harassing abortion providers and their patients. This is yet another in a long line of extremist attempts to end abortion in Tennessee. Under this bill, patients wouldn't even have the option of sending fetal tissue to pathology like hospitals have. This is treating it as a specialized area of care and specifically targeting abortion providers. I heard the sponsor talk about how he doesn't believe this will affect abortion care, and I recognize he's never worked in an abortion health center or talked with us, so he doesn't understand this fully, but it will affect us. We do have to figure out who is going to take care of the burials and the cremations and work with us. We don't know what the costs are going to look like, and in many ways this feels specifically like an abortion tax on us. I really appreciate you all taking the time to listen to me and consider this bill seriously, and I really hope you will oppose this bill.
All right. Thank you for your testimony. Are there questions for the sponsor? Representative Sherrill, you are recognized.
Just a comment, or maybe a question would say, isn't doctors, don't they go to school to save lives instead of to take and kill lives?
You're recognized.
I am not a doctor and I did not invent medical schools, so I don't think I'm the best person to answer that question, but I will say that the answer of life is a complicated question, and we as human beings do not get to decide that. Some people have different beliefs on when life begins, but we know that politicians, no disrespect intended, are not the experts.
I believe that, to my understanding, thank you, Chairman. I think to my understanding that we have some great doctors in our lives, and I think you said something about it takes a doctor to perform a abortion. I believe we have great doctors like Dr. Kumar sitting here beside of me that tries to save lives, and I believe this man has a heart, but I believe these people that perform abortions don't have a heart. But thank you very much.
Any further questions for the speaker? Okay. Chairman Kumar, you're recognized.
Thank you. Thank you for all of you who have testified for your courage and the points that you're making. I think our Legislative Assembly is composed of thoughtful people who will decide really based on their own values. I'm going to thank Representative Sherrill for complimenting me. Just to clarify, in the original Hippocratic Oath, abortion is not allowed. I'm taking a life is not allowed in the original oath. But then as life moves on and revisions happen, it was in 1964, a physician by the name of Dr. Louis Lasagna, easy to remember, at Tufts University, he did the revised oath in which this was left out and certain other things, including prayer to God. The original Hippocratic Oath opens by a prayer to Apollo. That is what was the god at that time. God was taken out, a prohibition against abortion was taken out, and membership to AMA was put in. Those are the times we live in, how things have changed. But I just wanted to clarify that in the original oath, it was against, again, our job was to totally pro-life, support life in every way that we can. And thank you, Mr. Chairman.
All right. Thank you for the history lesson. That was good. Representative Clemens, you're recognized.
Yeah, thank you, Mr. Chairman. I just had a couple of questions or clarifications, and thankfully, medical science has improved since Hippocratic Oath originated from Greek. But anyway, how many surgical abortions can be or are performed at a clinic a day? I heard 50. That seems like a lot to me, but it may be accurate. Can you answer that?
You're recognized.
Thank you. Thank you. That's a great question. While I don't know the specific numbers, because obviously things change over time and depending on what laws are in place, how hard things can be to access in different states, I know that 50 is a lot more than ever happened in a single day at the health center I worked at, Knoxville Center for Reproductive Health. I also believe some of the previous speakers got a little bit confused and were adding together the totals of medication abortion and surgical abortion to get to that 10,000 number. So then when you're dividing that to get to how many surgicals happen in a day, that seems to be a little bit messy, and I imagine where their math got a little confused.
Representative Clemens.
Yeah, thank you, Mr. Chairman. And well, I'm sorry, I have a lot of questions, but I'll leave it at that. Thank you, Mr. Chairman.
All right. Thank you. Chairman Williams, you're recognized.
Thank you. Thank you for your testimony today. We don't see each other from the same view, but that doesn't mean it's not your view. And so I can appreciate that. I will say, you testified that you dispose of medical waste much like other medical entities would. I guess the question as it relates to medical waste is, do you see a difference between, say, a non-cancerous tumor and an aborted fetus?
You're recognized.
I think that is a complicated question where I am not a medical expert. I'm not a doctor. I don't feel qualified enough to answer that. I think for individual human experiences and how they feel about their bodies and procedures, that's a whole other complicated area. So I think when we talk about the differences between the two, I don't think there is an actual answer there.
Chairman, you're recognized.
Thank you for your answer. I think for me, if I were to treat a tumor and a fetus the same by putting them in the same place, then my actions would determine what my view is. And I think in this instance, when we're told by your testimony that you are disposing of fetal remains as the same as another medical provider might a tumor, then by the nature of your view, you dispose of it that way. I think the challenge which my colleagues on both sides of the aisle would say is that this is a very polarizing issue on either side of the debate, and so it makes it very difficult. But I think that most of us view this as, at least in this state, would view those fetal remains as just, in fact, a child, and not a mass or a tumor that someone would have removed. My colleague from Nashville communicates very well about the changes of the Hippocratic Oath and how they were a dark age of years gone past. But I think over time we've lost our way in a lot of ways. And in this case, even in the last 40 years, the science and the miraculous events which occur in the womb, we know way far better today than we did then. It's not a dark place of the unknown as it were in the late 60s. And so I think that's what complicates the situation, because we are wiser and technology shows us four-dimensional photos of what we once knew as a dark void. And so I want to thank you for your testimony today, and I appreciate you answering my questions.
And can I
You're recognized.
Yeah, thank you. I really appreciate you saying that, because I am not going to pretend like all of this is not complicated. I actually don't believe this is an either-or issue of us, them, pro-choice, pro-life. I believe everybody has very complicated, nuanced ideas on abortion, and that should be allowed. But when we have our government making these uniform blank policies, that can't really be allowed. And that's where I'm coming from, is the concerns about government overreach, because you talked about the historical perspective, and one thing I have found in my studies is that abortion has always existed as long as humanity has existed. There's evidence of abortion over 4,000 years ago. At the same time of the Hippocratic Oath, there were sort of jokes about a Hippocratic method of trying to induce a miscarriage by jumping up and getting your heels to touch your buttocks. Abortion is something we will always need and always look for, even when it is made incredibly difficult to access, like bills like this attempt to. And I want to make sure that abortion is safe and legal.
Chairman Williams.
I respect that, but I couldn't disagree more. So thank you.
Thank you. Representative Clemens, you're recognized.
Yeah, thank you, Mr. Chairman. I appreciate you coming back to me, and I appreciate my colleague from Putnam County's questions. I think his question was a fair one and really placed this difficult topic into a good window for discussion. Aside from that, I'm curious, are you able to speak to when, of those 10,800 abortions, or whatever that number was, how many of those are performed in the first trimester? Are you able to answer that question?
You're recognized.
I don't have the exact number off the top of my head, but it is the vast majority, definitely at least 90%, especially most of the abortion providers in the state of Tennessee, because of only providing medication abortion, only go to 10 or 11 weeks. And then most of the surgical facilities also only go to about 14 or 15 weeks, just a few weeks after that first trimester. So it is the vast, vast majority. And when we talk about abortions that do happen later in the first trimester, that's where we are talking about hospitals, which this bill doesn't cover.
Representative Clemens.
Yeah, thank you. And that's my point. We've heard some very shocking, graphic explanations of the alleged process here and what's happening. And so, I'm speaking as a layman, and what a fetus looks like at that period of time where these abortions are taking place. And I'm trying to get the two, reach some agreement there with the context of the testimony we've heard thus far, with what's actually happening, the type of ones we're seeking to regulate. So if you want to respond to that, that's fine. If not, I appreciate your testimony.
Right. Thank you. Okay. All right. Any further questions? Okay. Seeing none, as you head back to your seat, I do want to thank all the those that came and testified. Respect your opinions, respect your right. Again, thank you for coming and testifying. So without objection, we will go back into session.